Hello, my name is Rivera,
And I'm Hilary Rivera.
and today we will be presenting on an article called Epidemiology of Pertussis in a Country with High Vaccination Coverage. So I'm going to start off by discussing why this study was performed. The reason for the study is to analyze the spread of pertussis in Catalonia, Spain, and its implication for control purposes. The scientists performed the study because although pertussis have been a preventable disease, the number of cases reported remains high. Pertussis, or whooping cough, is an infectious disease that causes respiratory infection. It affects both children and adults, but symptoms are more fatal and severe in infants, which leads to more hospitalization than in any other age group. Pertussis caused a lot of infant deaths before the vaccine was developed in 1965. In 1999, the vaccination schedule was changed from 5 and 7 months to be given now at 2, 4, and 6 months. 2 booster doses were also added to be given at 18 months and between ages 4 and 6 years old. Although this disease has been a preventable disease since the vaccine, annual number of cases remains high.
Catalonia remains a highly vaccinated population. However, every 2 to 5 years, an epidemic of pertussis occurs. The majority of the incidents and hospitalizations occur in infants. Pertussis in adults and adolescents are less frequent or less severe to where symptoms are unrecognizable as the illness. For the past 51 years, the disease has been preventable in Catalonia due to various vaccines that have been produced. The exposure to the most vulnerable population can occur from asymptomatic persons who have not received their vaccination.
So what were the major techniques used during this study? The study was conducted in Catalonia, Spain between January 2004 and December 2008. The study analyzed all reported cases of pertussis in the northeast region of Spain with a population of 7.5 million. This population accounts for 16% of the total population of Spain. A patient was tested for Bordetella pertussis if they presented with a persistent cough for 2 weeks or greater and showed at least one of the following symptoms: paroxysmal coughing followed by inspiratory whooping, post-tussive vomiting, or apnea. A confirmed case was a patient with whom a laboratory test was positive for Bordetella pertussis. A patient was suspected with the disease if they presented with the same symptoms but were not confirmed through laboratory testing. Lab tests such as culture analysis were performed at Microbiological Laboratory of Vall d'Hebron Hospital in Barcelona. An epidemiological record was compiled for each patient who tested positive by public health officers and were classified according to immunization status. Patients who received the corresponding vaccine dose according to their age, and also children greater than 12 years old who received their last dose within the last 5 years were considered correctly vaccinated. Patients who received some doses of the vaccine but not the correct doses were considered partially vaccinated. Patients who did not receive any vaccination were considered unvaccinated. Incidence rate, rate ratio, and 95% confidence intervals were calculated. The population was estimated by Statistical Institute of Catalonia and was used to calculate the incidence rate, and chi-square test was used to compare the population.
The major results of the study are that there were a total of 555 confirmed cases over a 4-year span. Infants less than 1 year of age accounted for 93.7% of hospitalizations for pertussis. The incidence of those who became ill with pertussis older than 1 year of age is significantly lower. The cases among those who have not completed their pertussis vaccination DTPA series. These results support the objective of the study, in which is to find the epidemiology of pertussis in Catalonia. The study has a possibility to point to future studies that can determine why people in Catalonia are not vaccinated or the incidence of pertussis in upcoming years.
So why did we choose this particular article to review? When we were brainstorming of what topic to research, we were both very interested in pediatric diseases. So we chose this particular article to review because we also believed that it was easy to understand and contained all the information that we needed. We chose this particular disease because pertussis is a preventable disease that can affect anyone, yet not everyone is taking advantage of the vaccine to prevent this disease. Studies show that 37.5% of reported cases were among those that were not vaccinated, and more than half of these unvaccinated individuals were infants less than 3 months of age. This is the age group that has the highest fatality due to smaller and shorter airways. Contracting this infection in this age group causes the most deaths than in any other age group. So, although this study did not show the number of deaths due to the disease, it is safe to say that individuals who had this disease suffered from respiratory distress. This could have been completely preventable. So, was this article interesting? The study was very interesting and informative for us. It showed us that although this disease is completely preventable, people are still not taking the necessary preventative measures, and reported cases remains high. It is clearly written with simple language that made it easy for us to understand. The graphs were very helpful that showed the different incidence rate between different age groups, as well as the different symptoms each individual presented with that led to the testing and confirmation of the disease.
So what were the strengths and limitations of the article? The strengths of this article is due to the amount of data collection. The studied years results of reportable cases are broken up by total cases per year. This is a strength in the study because it shows clearly that there are a significant increase in cases every couple of years. Although another strength of the study is that the researchers broke down the incidences by age group. By displaying the information by age of the study was able to identify the most affected age group that is affected by the disease. A limitation of the study is that researchers believe that an increase in incidences could be due to increased surveillance. This is a limitation because although the study shows an increase in cases, this may not be as significant as the data shows. So what can we learn from this study? This research showed that the number of people that are not vaccinated, which increases the spread of the disease. Public health officials and workers should make more of an effort in educating the public regarding the importance of vaccinations. Infants less than 3 months are most affected by the disease. However, they are not able to receive the vaccination at this time. Therefore, it is important to vaccinate friends and family members that would come in contact with the infant, because the infant would highly depend on the family's immunization. It would not only protect the individual from getting the disease, but also protect the infant who is unable to protect itself. Public health workers should also educate the public regarding Bordetella pertussis and its effect on those in the community. As future nurses, it is important for us to be knowledgeable regarding this disease and the importance of educating, treating, and caring for people who suffers from pertussis.
We hope this presentation was as informative for you as it was for us. Thank you.
Thank you.